Diana came to see us. She had all her teeth. She didn't have any issues regarding functions. Her issues were strictly cosmetic. She had some sensitivity issues, but she had a lot of cosmetic issues. And as you'll see from her before and afters, her teeth were actually reasonably healthy, but just not the nicest set of teeth. And she was really feeling self-conscious about that. What we were able to do was dramatic from an aesthetic point of view, but it also made a dramatic change to her, how she feels about herself. And that's what rebuilding people's smiles can really do. It can not only transform us from a functional point of view, health point of view, and cosmetic, but also from a self-esteem point of view.
Well, I had a couple of major concerns before I had the work done. First one was a psychological one, because I knew that you had to shave the tooth enamel somewhat to put the veneers on, and I was concerned about the fact that that would be an irreversible process, that we actually had to invade the teeth, as it were. So, and that concern actually held me back from having the work done for a good year, maybe a year and a half before I actually decided to go for it. So I would say to anybody that's really struggling with the decision because of that fact, to get over it a lot quicker than I did, because I wasted a certain amount of emotional energy on that had I known how well it would work and how good it would turn out, I would have had it done in a heartbeat. When you did examine my teeth, I had some recession, so we had to take care of that first, and I went to a very good surgeon to have that done, and so that was a bit of work. Dr. Bello just took me through it one step at a time and guided the whole process. He spent quite a lot of time explaining what he was going to be doing, what he hoped to achieve, and then when we did the mock-up so that I could actually see what it was basically going to look like, or at least have a very good approximation, that turned out to be a really good idea. He wasn't directing or patriarchal or any of those kinds of things. I was truly on board with the complete decision all along the way, and I had more than enough variables to go on. So it was a no-risk decision, and very happy. I would add, in Dr. Bello's case, for example, that it's not only the technical aspect. I mean, dentists are dentists, they are trained to do certain work, but he brought a great level of artistry to what he was doing. And even when we were discussing the procedure first, he was talking about the luminosity of the veneers, the transparency of them. He really understands the nature of light as it works with your teeth. So I found him to be an artist as well as a good technician, and that was super. Because when you have a really nice smile, you look like a happy person, and people like happy people. So. And it's easy to smile when you have a nice smile. I find that I smile a lot more.